Are we live?
Potentially.
Let's
I know we're
see.
connected to the cafe.
Bada boop bop bing. Looks like we are.
Heck yeah, it worked. Potentially.
Good morning, everyone. Welcome to the Medicare Cafe. We're so glad that you've joined us here today. As you can see, slightly different host every week. You never know who you're going to get. We like to keep it that way.
Yeah, this plant is joining us today.
The plant is joining us today. It'll be doing the bulk of the presentation, so hope you learn a lot. No, my name is Sadie Palmer, and most of the time I'm behind the camera doing stuff like that. But, you know, every once in a while they pull me up here for whatever reason.
We should pull you up here more often. I feel like we always have a lot more fun.
I can add fun. I don't know about anything else, but I can add fun.
That's all we're looking for. I feel like 90% of the time we're just looking for more fun. So, good morning. Good morning.
Good morning.
Well, this is the pre-chat. So, we've got...
Well, who are you?
Oh, no, I'm nobody. Don't worry.
Never mind. Moving on.
I know you guys probably maybe recognize me. Maybe not. I have let myself go. I've just came back from surviving on an island for 37 days.
Nice.
So yeah, it was
nice retreat.
Yeah, it was super relaxing.
Right.
Wasn't scared at all.
Totally.
But I'm Benjamin Lavis. I am part of the Agent Resources team, head senior marketing specialist, and occasional host.
Oh yeah.
On the cafe. So,
oh yeah.
But yeah, he's nobody. Yeah, see, even the viewers understand. Yeah, I'm nobody. It's all good. Yeah. But this is the pre-chat, so welcome in everybody. We're gonna give it a couple moments while everyone is kind of getting the notifications that we've gone live. We've got some fun stuff to talk about. Because Olivia's not here, Sadie was like, put whatever you want on the slides, and I said,
absolutely.
All right, sounds good.
Let's do it.
This is a. Nobody made these slides.
No. Ben's selling himself short. Ben, every day, your whole job is to work and talk to agents. So if there's literally anybody who knows what agents are asking, everything from the agent perspective, like, it's you. So yeah, you're selling yourself short.
That's true.
You got some good stuff.
I've been trying to do better about that. I have a lot of fun doing what I do, but Gail being one of the agents that I worked very closely with over the past. This will be my fourth. I'm going on 4 years.
Yep, 4 years.
That's insane to think about. I didn't even know how to spell Medicare up until like 2 years ago.
Amen. So. Yeah.
Yeah, she should have saved this morning.
Right.
So, but it's all good. It's okay. But yeah, so we've got a whole bunch of fun stuff. We'll kind of get into that. I guess, do you have a fun cafe topic? I mean, I have stressful topics I can talk about, being what my wife and I are currently trying to go after in house hunting.
Well, it's stressful for you, but it's fun for me because I love hearing it, and I am not having to deal with the stress, so it's fun to hear of somebody else going through the process without having that emotional connection.
Yeah, it's to
buying a house. I don't know if we actually said that.
No,
we were just like alluding to the stressful thing, and then we like never say what it is.
Yeah, no, it's I coined the term terrifyingly exciting because it's nothing that I didn't find a cool podcast to help me understand all of the things and insights and that are a part of just the conversation that is house buying or home buying.
The market.
And so lots of self-study, trying to learn all that type of stuff. So it's terrifyingly exciting.
Yeah.
But last night, my wife and I signed paperwork and submitted an offer, so we shall see.
Now he no longer has to live on an island. He will have a home.
Yeah, that's basically, I had to save up for the down payment, so we sold everything, and I've been living amongst the hermit crabs. So
yeah, nice.
Well,
cool.
Perfect.
Let's roll into it.
Yeah, so welcome into the Medicare Cafe, where we will kind of go over a couple different topics or whatnot. I've got some fun ones here today, so this is kind of what you guys can expect. Tech talk. I wanted to say tech deck.
Tech deck, as in the finger skateboarding.
Exactly.
Oh, I'm well aware.
Yeah, You ever just need a little second?
I'm familiar with the shred. Yeah. Absolutely.
The shred. We'll talk about quoting, and specifically supplemental quoting. We're seeing a lot of change on the supplemental side. Honestly, yesterday, I had a lot of conversations with agents and agencies about, hey, what does the future of Medicare supplements look like? I'm sure there's probably a good chunk of questions from our recent event that we had done
for sure.
At the Medicare Quick Start here in office.
Yes.
Then we'll go into the question of the week, which are events even worth it? And spoiler, heck yeah, they are. So we'll talk into some of that, and then I want to challenge a lot of the viewers and viewers today with the tip of the week is: do you really know your client? And do you really know them?
Cool.
How well do you know them?
Yeah.
So that's kind of what I have plans.
Sweet.
And
that's my number right there on the banner. Feel free to text me, and we'll be able to answer you that way. But yeah, Ben, let's roll into it.
Good deal. Yeah, or if you wanted to put anything in the live chat, we've got that pulled up as well. So first and foremost, tech talk.
Tech talk.
Rates be rising. Rates right now, I think last year we experienced a lot of double-digit rate increases. It was a huge conversation that we had. People had to consider Medicare Advantage more seriously for the first time. We saw mainly the two contenders that we normally talk about, F and G.
Yeah.
We're seeing double-digit rate increases, whether it was catching up to the T65 rates because those hadn't changed in 10 years or whatever it may be. But also still recovering from COVID. That's a huge conversation we've had on the cafe in the past is the loss ratios that the supplements have been going through. They have been hemorrhaging money. And it was supposed to settle, and it just hasn't.
And it hasn't, yeah.
And
it doesn't look like it's going to be settling anytime soon.
Literally anytime soon. Yep. We've already gotten a handful of carrier reports outlining that they are expecting double-digit rate increases. And I've seen as high as 30%. So specifically, that would be a Colorado. So if any of our viewers are tuning in from the great state, make sure you're taking a look at your rate increases across the board. But yeah, we're seeing a standard in the industry right now is 15 to 20%.
Yeah, that's painful. But
I can think of maybe one carrier that has not been double digits, and when it wasn't double digits, it was literally 9.9%.
Right.
So
yeah.
it was so
hanging on by a thread.
We're not a double-digit rate increase.
Totally.
So that's going to be very similar to what we saw last year.
It'll be another interesting year for sure. But one thing that you want to keep in mind is that just because things are going up and they're changing, there's multiple rate increases happening on a lot of plans. Doesn't mean you need to be training your agents or your clients, to be hopping from plan to plan, because if they jump to a different plan, that's probably going to get a rate increase too. It's not going to end. But in the case that your client does want to change, there are tools that can help you look for those different things and look to see what's getting rate increases, help you predict, look at past rate increases and stuff like that. And that's CSG.
100%. That's actually a really good segue. So that's kind of one of the things that I wanted to touch on was you guys have access many times through your upline. I know here at Senior Marketing Specialist, we have a quote engine here that we use through CSG. If you're using Medicare Center, you have access to CSG. You can change and toggle over to that in the top right-hand corner. And there's three main things that I want to bring to your guys' attention that I think are unsung heroes or unsung features of CSG that I don't think a lot of people use. The first one being the data market. And so that is a list. So as soon as you sign into CSG, you will be brought to your kind of dashboard. It'll say, what type of quote do you want to run? A Medicare supplement, ancillary, whatever it may be. If you actually scroll down, and I snagged a picture for us, this will be the bottom left-hand corner image. You will actually be able to see the rate change logs. Now, this is something that is only accessible through our CSG quote engine. I don't believe it's currently live on the Medicare Center platform for CSG, but I know Gail specifically uses that, and we work through using CSG together a good chunk, and you'll be able to see, hey, what plans took what increases, what percentage, what plan letters, and so it's super helpful to be able to sit down and kind of, okay, when did they take one last year? Because it goes back a good, I think, at least a year.
Yeah.
That's super easily accessible. So that's a tidbit or whatnot. You can download that PDF and take a look at kind of what rate increases are you guys seeing and expecting in the market.
Yeah, for sure.
That's been super helpful. The other images or whatnot that I'll showcase is actually after you've ran the quote. I pulled in all this information just for our area, T65 female, and was showcasing ACE specifically. On the left-hand side, when you guys are running these quotes, you can click Market Analytics, and that will pop up this increase history and market data underneath your quote. Really, the call outs here are increase history. You can see, I think it's like the last 5 separate rate increases that they've taken. So you can kind of see what type of trend have they been on, which is super helpful. It is not, and you mentioned this a little bit earlier, it is not just about the current premium that you should be selling supplements on. Because if you're training your client to do that, you're going to be meeting with them every single time their rate changes.
Right.
Which your hope is to be able to explain and outline, hey, the supplement we have you on is, has benefits, is a competitive price, is stable, has been in this space for a really long time.
Right. Well, and right now, and really for a long time, but especially in the last couple of years, you weren't selling Medicare supplements for the cheap cost, right? Like that has never been the appeal. That's never been what you sell. You sell it based on the convenience of it. And that's what it has been. That's what it will continue to be. It will continue to be more and more of a luxury item. Yeah. And luxury items you don't sell based on the price. You sell on what you're getting. Yeah. So that's just kind of following that trend. You don't want to talk. It's just going to keep going up in premium. 100%. If somebody wants it, it's because they want the convenience, not because it's a deal, a steal.
100%. You're not buying your yachts or whatnot or a boat because, it's the cheapest boat out there.
Right.
I mean, maybe you are, and I'd love to hear how your experience with boating has gone, but, those are expensive items, and there's other things to kind of take into account when looking at those options, so you're exactly right. So the market analytics we talked about a little bit, so you'll be able to see the loss ratio as well. A good rate to kind of look at is carriers try to shoot for about an 80% loss ratio. So on this right hand side, it's the bigger image towards the middle. I have it highlighted there. You'll see both at a national level and then at a state level. And so I think the state level for ACE was right around I want to say 60-70%, and that's been about where they're at nationally as well. So they're actually under kind of that threshold where they want to be. Mm-hmm. So looking at this, you could say, well, hey, ACE is not hemorrhaging a lot of money. Maybe they're a little bit more static on their loss ratio. Yeah. I know this is 2023 data because 2024 hasn't been uploaded just yet, but it's a good kind of way to look at it. What have they done over the years? It's a really good way to see, Mutual of Omaha has been in the market for a really long time. What has their loss ratio been over the past 5 years? And what type of things can I predict based off of that information?
Yeah, totally.
You guys know me. I'm a huge numbers person. I've always been about the data and making it as digestible and helpful for your guys' business as possible. So this is a really good way to take a look at rate increase history as well as, hey, what kind of position is this carrier in moving forward as far as their financials without actually knowing their financials. Yeah. So a really good tool. And if you guys ever need to, you can always see in that top part the effective date. So this one I think is August of 2023 or 2024. That was the effective date of their last rate increase. So you can kind of gauge that as we're getting closer to that date. Hey, okay, maybe I need to start, make a sticky note. Okay, I'm expecting a rate increase announcement from this carrier around that time as well.
Cool.
So yeah, CSG is super helpful. There's a lot of tools and resources out there that I think, like you said, agents don't always know or how to use the full package of those resources. And so it's super helpful.
Well, and the more and more we get in the more our industry evolves into being very tech heavy. It already is. It's only going to keep getting more tech heavy because that's just how the world is. With tech, data's king. And so in order to continue to be up with the trends, make sure that you are keeping track of how to run your business the best way that it can. You have to stay on top of that data, especially whenever there's so many changes and have been so many changes in the past and only continue. It's so important more than ever to make sure that you're looking at those things and you're looking at your business from a 100%. Numbers standpoint and not just how much money you're making from all the other stuff as well.
Yeah, no, it's the more organized you can be and use the resources that take less of your time allows you more money-making opportunity time. Mm-hmm. So you can have one more appointment. That way you're not waiting on holds with a carrier trying to figure out some of this information. So the more of that stuff you guys can use, it will quite literally make you more money.
Sweet.
From there, we can kind of switch over to the question of the day. And I think, you have outlined events in the past and have done Medicare Quick Start and kind of talked about that. Are events
Yeah.
even worth it? And I just was like, short answer, yes. Longer answer, yes.
Yes, that's exactly right. Yeah, events are huge. We love talking about events. Events are one of those things where we used to say, like, kind of before COVID, if they're really great, but it's not your thing. There's other ways to market and stuff like that. Just the way that the market is right now, people aren't door knocking. Obviously, that's not allowed anymore.
Right.
Mailers are not having return rates as good. We're kind of getting lower and lower on the list of things that are a bit more like physical in ways in which you can connect with people. And so events are huge. And that's not the only reason why events are huge, but they are just becoming more and more of a thing. And also, it's nice around AEP and before AEP and stuff like that. If you start doing events now, then you're able to kind of get in the rep and get a lot more comfortable with it before you start doing your ANOC presentations and bulk presentations like that. Knocks out a lot of appointments. It's also a really, really great way for you to get referrals because you say, hey, come to this event that I'm hosting and bring a friend.
Yeah.
And people do. And so you can have kind of mass appointments or have like kind of a mass communication with people.
You were taking words right off the slides that you didn't even know we had.
Oh, let's go. It's
Boom.
like I know this.
You do know this.
Yeah.
Perfect. Yeah, no, there's so much value. So you mentioned the referrals. So the agent value side is a really easy way to have you bring in friends. If you already have referral partners, Carrie preaches this a lot, that doing a one-on-one event with a referral partner is probably one of the best ways that you can solidify and enhance that relationship with that referral partner.
Yeah.
Because they don't have to worry about, hey, I'm going to come in and just talk to your clients. I want to take care of them specifically. I'll act as a branch from your tree. And it just makes it very, very easy. And Brittany brings up a good point as well. Talk to your carrier reps now. They're going to either connect you with who needs to show up to your events. They're probably already starting to schedule a lot of this stuff out. I mean, their time frame is not someone like, oh, Monday sounds like a good time that I should, next week would be fun to do an event. Like, there's a lot of planning that goes into that, and especially if you're bringing in carrier reps.
Yeah.
So if you can establish that relationship now, I think you mentioned something, how this industry is changing to what matters to the client, and it's less so. You mentioned like mailers and all these other aspects. Those aren't as effective anymore. It's because someone's looking for someone to help them and provide a relationship through it.
Yeah.
And events do that, do a really good job of that because they outline, I have a person, this person was educating. It's not a sales tactic.
Right.
I'm just educating the masses.
Right.
My value as an agent of informing these clients is, hey, even if you don't work with me, now you're better equipped to take care of yourself, take care of a loved one. That's a whole other thing that I could probably touch on that isn't really even included in these slides, is even if the person attending at your event isn't Medicare eligible, the likelihood of them taking care of someone who is Medicare eligible is astronomically high.
Yeah.
And so I know social media is a whole other avenue that has been discussed, and I would love to hear agents' viewpoints on why they aren't doing events. Is it something that there's a barrier? I know Gail and I worked very closely about, introducing events, and I won't steal her thunder, but she actually ended up really enjoying it and thought it went really well, and it was a lot easier than I think she maybe initially thought. And I think that's part of like the mantra with events.
Totally.
I think they seem very heavy.
Yeah. I think that people get nervous about all the compliance around it.
That's fair.
In the way that like people just get nervous about anything that involves like a lot of compliance. shouldn't be nervous, but like, of course you should be conscious of it.
Yeah,
But
aware.
that's like one reason why we say do educational and not sales, is because the compliance is different. It's a little bit easier. You have like an excuse to be like, well, we're not going to talk about that right now. If you just kind of like dip your toe, which I actually hate that expression, but for some reason I always use it because I don't know what else to say. But get your feet wet. I hate that.
Test the waters.
I don't like test the waters. Yeah. In order to test the waters for it, get used to it. Do things that are a little bit more niche. Do how Medicare works with VA, Medicare for people with diabetes. Do things like that that are a bit more niche, kind of shows you as the real expert in the area. If you do a Medicare 101, those are great. Just make sure that you're not talking any Part C or Part D plan specifics or anything like that. You just keep it to Medicare 101. And if you're looking for a way, this is a big one. If you're looking for a way to make your appointment shorter, you should be doing events, because then you're able to knock out a lot of that educational. Like if you're doing Medicare 101 events regularly, and that's another thing, if you're doing events, you need to do them regularly, say once a month at this room in the Golden Corral or something, or in the library. A lot of people do like library. Then people know that you're consistently there. They know where to find you. You keep your face there. They know you as the expert that gets out and talks to people. And so what was I talking about before I started saying that? Oh, this is why they don't let me in front of the camera. Anyway, events are really, really great. Really great way to knock out
shortening appointments.
Really great way to knock out a lot of that Medicare 101. Because sometimes we often say like, there's that one page that explains the different parts of Medicare in the Medicare and You handbook. But there are some people that are just like, I simply cannot do that.
Yeah.
I simply can't. Okay, that's great. Do an event. Do Medicare 101. Invite people to that. Say, hey, before we meet for our next appointment and everything like that, I have Medicare 101 events that I do every once a month. Join that one. And then whenever we come in, we'll answer any questions that you have. And then we'll go through the rest of the process.
Yeah.
That way you're not skipping that. You feel like they've got a good education, or it gives them an option if they want a long Medicare 101 or if they don't.
Yeah.
But yeah, finding niches as well. Olivia always says that, like the veterans, like the diabetes, like stuff like that, really shows you as the expert in a bit more of those niche, kind of gets more of a specific crowd that comes in for those things. They can bring friends, and really great for referral partners as well. Those networking partners.
100%.
Really, really great.
I think the specific nature of it too helps with closing ratio. Like if you're doing a super broad one, like, yes, you're providing a lot of value to the clients. You can also even word those like Medicare 101s as just like Medicare industry updates. That way you can have repeat visitors to those events and kind of get butts in seats is a huge phrase that we use. And then during the summer, we almost always have huge updates hitting our industry. And if you can be some of the forerunners of being loud and educating kind of what's going on, especially that might affect a client of yours or a client's friend that is not a client of yours just yet, that helps kind of repeat visitors. And the more times they get in front of you, the stickier of a client they will become.
If they see you face to face, I mean, just like think about it. It like brands that you just see billboards and whatnot, that's so important. Having your branding out there, having those touch points via brand is so important.
I agree.
But if they meet you in person, there's just naturally going to be something there that is going to have them more inclined to you than your competitor that's on like the billboard. And a lot of people are starting to do events now. And so even just like adding that pressure, if your competition's doing events, you should be doing events, because then that means they are meeting, or they're offering a service that your clients want. So then they're going to your competition's events. So just keep that in mind. Also, there's a question here that I'm not used to answering these, so sorry, Lee. I was a little bit late on this. But do you call your existing clients to tell them of the increase, or do you want to wait, going back to the MedSup increase? Or do you want to wait to answer their questions when they receive the letter talking about their future increase? That's a really good question.
It's a really good question, Lee. I think where my brain goes, and I think agents find the avenue that works best, obviously, for your situation. You don't want to be the boy who cries wolf and scare your clients into supplement rate increases. We need to make a change.
Yeah.
I think there is importance that they hear about their change coming from you rather than just a piece of paper. So if you're getting inklings or ideas that a supplement rate increase is happening to your clients in your book of business, even if it's an email or if you have an administrative assistant in the office that could leave a voicemail or try to reach that client, just saying, hey, we've heard through the pipeline because of how, we as your agent have heard through the pipeline that your carrier's likely going to be expecting a rate increase. You should be receiving a letter in the mail, or you may see it over email or in your portal, depending on how the client accesses their or their carrier information. I think there is a ton of value in the client hearing that from you instead of directly hearing it from the carrier.
Well, and you can even like immediately back that up with, hey, this is happening, and then reassure them. That doesn't mean we have to move. If you do want to move, I'm here. So that way they're not just getting the notification of the rate increase and then they have to sit there and figure out, well, what does this mean?
Exactly.
If you're able to notify them, then you're also able to reassure them right then and remind them, hey, if you do want to change, come to me, but also this is just what the market's. You're able to have that conversation right there, which will make them feel taken care of. And it'll be like a really nice intentional contact that I think people will value.
I completely agree. And not to mention, I was working with an agency just recently who outlined for like birthday, and they stopped doing birthday cards and started doing birthday phone calls. And if it was a voicemail, they would sing happy birthday. And it was very different for first off, but the amount of times they would sing happy birthday.
So they would call the person and they'd sing happy birthday?
Yeah. It was very, very unique. Not for everyone, but very unique. And they found that a higher percent of time than they anticipated was, hey, while I have you, I had a question about home health care.
Oh, 100%.
Oh, hey, while I had you. So the more touch points you have with those clients, whether it's about rate increases or a newsletter or anything that can get you in front of them, it opens the door to, hey, while I have you, which are super great, because that, hey, while I have you doesn't turn into, how do I solve this on my own? Oh, well, let me go to Google. Let me go to Medicare.gov. Well, let me call this phone number and see if I can get information there. And then bam, they're no longer your client.
Yeah.
So
100%.
I think that's a really good question, Lee. I appreciate you asking that.
That is a good question.
It's however you want to implement it into your agency. If you want to have kind of those types of discussions, this is exactly what this is for. I would say coming from the agency as a whole, whether it's an administrative assistant, an email, or something from you guys as kind of a wrap up, is essential, especially with double digits, potentially 20% rate increases, 30% in some states and areas.
Yeah.
That's a big change. And you need to be the lighthouse that's like, hey, I understand things are changing. We're going to get through it together.
Yeah.
That's the huge part of that.
Yes. And explain to them a little bit, because as we all know, like there's a lot of misinformation that can happen very quickly with stuff like this. And so you don't want them even seeing something on Facebook or something like that and freaking out. So just
commercial.
Yeah. Having them hear it from you.
Yeah. No, that's perfect. I want to kind of make sure we've got all the stuff for events too, real quick. You mentioned niches, and I think that's really, really good, specifically continuing with kind of the supplemental train. Talk about Plan N.
Yeah, love that idea.
We have been on the Plan N train for quite a while and
years,
and hooting the horn.
Yeah,
and the
3 years
yards.
was whenever we did our first webinar about why Plan N. 3 years ago.
3 years ago. That's actually insane to think about, and it's coming back around. Not only the rate increases on G and F, obviously we're seeing double digit again. N is not being as subjected to those high of rate increases. They're the biggest reasons I hear, oh, well, my clients don't like Plan N. It's either the copays, which even if you saw a doctor or went to the emergency room every single month and were subject to those copays every single month, which we know is just not normally the case, you're still making it out ahead many times. And the other one being the excess charges. Well, 97% of providers accept Medicare assignment. It is just not as common. And of that 3% remaining, it's like the Mayo Clinic or mental health therapist. So it's a very niche. So make sure you as an agent are educated on those types of things. We just released here, at least at Senior Marketing Specialist, a whole nother segment of our AEP toolkits that is just Plan N resources. So the video that Sadie was highlighting, a fillable sheet that kind of highlights some of the things that you can get out to your clients. I'm telling you right now, Sadie did this perfectly. This is a big one, so listen up. If you're not offering Plan N this year, you're going to see a drop in your Medicare supplement business.
Yeah.
People have to financially consider it. If they're not willing to go Advantage, they have to find a way to make a different decision, and that is likely going to draw their attention to Plan N.
Yeah. And, one pushback that we've gotten a lot from agents is, well, I might as well just move them to a Medicare Advantage plan then. Then they don't have the premium. Then they have like the co-pays and like whatnot. We've gotten that a lot, but you have to keep in mind, again, Medicare supplements are desired and wanted for completely different reasons than Medicare Advantage plans.
100%.
So this is a way for people to have that consistency. They don't have to meet with you every year. Yep. They know what to expect whenever, especially those people who aren't going to see specialists and stuff like that with the excess charges. Again, excess charges aren't something that you should be too worried about. It's not going to be that much more. But you just have to keep in mind that it isn't the same thing as moving someone Plan N and then they're completely different. You're selling. So if there is somebody who really wants to stay on a Medicare supplement because that's what they know, that's what they, I know someone who was on a Medicare supplement, went to a Medicare Advantage and then, used their trial right and went back to a Medicare supplement simply because they were like, well, I can go to a Medicare Advantage plan anytime I want. I just want to stay on this supplement. Yeah. You're going to have some people that are like that. They're used to it. They know how it works, all that sorts of thing. And then also it's just this new era of Medicare supplements are changing. Yeah. And so people aren't going to be able to get Medicare supplements are not going to be what they used to be as far as like the price and affordability. Yeah. So you're just going to have to re-educate your clients. Plan N is what Medicare supplements are now. Yeah. It's either you pay really more expensive for this Plan G. That's okay. You can do that. But now it's not F and G. It's G and N. And so you just kind of have to rewire our brain to what the Medicare supplement market is now and rewire their brain to what the Medicare supplement.
I loved that. F and G. F and G. F and G. It sounds like you're really F and G.
The F and G. The F and G plan.
But it's F and G. I was just laughing. I was like, F and G. And I was like, whoa. I was like,
my lazy American English is just F and G.
I just thought that was too funny. I had to comment on it. It's amazing. But everything Sadie just outlined is 1,000% correct. I want to give like 3 quick points on like the Plan N thing. As actually kind of we can talk about this maybe a little bit more as we talk about our next aspect. How well do you know your clients? And I think it's a great segue because you just outlined a lot of clients are going to have different intentions with their coverage. So we've talked about mining your data on previous cafes. It's been a huge conversation that I've been having with agents and agencies. Now I want to tackle on how do you use the data that you've mined. We've talked about referral partners. You can find referral partners among Common Ground. Common Ground Coffee.
Listen, I'm so pro more coffee puns on the Medicare Cafe.
I knew you were going to like that one.
I do. I love it. I love a theme.
The Common Ground.
I love a theme.
Yeah. I was like, oh, this one's for Sadie. So I was adding it in. So what do I mean by finding the common ground? When you are mining your data, make sure you know what pharmacies they're using, what provider offices they use, what doctors they're using. And then one that I don't think everyone always asks is prior employers. Where did you retire from? Why is that important? Because all of those can be your next referral partner. If you have a block of clients, of 50 clients that all go to the same pharmacy, you are already working very closely with that pharmacy. Introduce yourself to that pharmacy. Say, hey, we already work together. I cover probably 50 to 80 people that come to your pharmacy on a weekly, monthly, yearly basis. How can we work better together? What plans do you guys like to utilize? What plans are you finding the network and the claim status is working well for you? How can we work together? What type of education can we fill from that? Same with provider's office. Introduce yourself to doctors. Hey, I have 20 people from the same kind of like family lineage that all come to you. How can we be working together? When you have that common ground, it is not a, hey, would you consider working with me? It's, hey, we're already working together. We just didn't know it.
Yeah.
I'm bringing it up and I want to work better to you.
Let me handle this part. You handle that part.
1,000%.
Yeah.
It's so helpful. I love the previous employer one too, because you can ask like one question. If you guys take anything away on like marketing side and referral partners, this is what you need to take away. If you can find the common ground on past employers, simply just say, hey, I know I actually work with a couple people from that employer. Do you have the human resources person's contact information? That way I could reach out to them. If you can get that HR number or have that in with that group, you can do a whole presentation for the entire next class that's retiring or the next year's worth of people that's retiring. I mean, Senior Marketing Specialist has that HR quick reference guide that you could then provide to that person as well. So there's a lot of opportunity in mining the data of your own clients.
Yeah.
And a lot of opportunity that strives then from it to write business, because you also find missing coverage. How many times have we talked about dental, vision, hearing, cancer insurance? Shoot, you could even talk about annuities. We've talked a lot about how things are getting more expensive. One way to solve that expensive cost is to have more income. And if they had savings or a 401k or something differently that you could put into a different kind of package or bow and have a higher income level on a month-to-month basis, that helps solve that higher cost problem that you guys may be experiencing on the client side. So you see a lot of those gaps kind of unveil themselves.
Yes, that's so true. We're seeing a lot of people moving from, because we work with agents nationwide, we're seeing a lot of people move a lot of their Medicare supplement clients to that plan in. And so in order to supplement that, loss of income, they're adding annuities, they're adding DBH, they're adding they're really getting into cross-selling now if they haven't been. So, yeah.
I think there is a comfortability that comes and is provided to the client when an agent leaves that door open. Don't be the reason a client comes to you and say, hey, I really wish I would have had this type of plan. Whether it's DVH, cancer insurance, or whatever it may be. I really wish I would have had that. A lot of you guys are set up with carriers that do offer those products. Do not be the reason you're not selling them. At least make it known to your clients, to all that type, anything that you guys could do.
And on a fun side, you can earn trips.
Yeah. I mean, that's a whole other layer. I mean, Plan N and ancillary, we didn't even talk about kind of some of the commission opportunities. We talk a lot here in Missouri about Missouri Anniversary is not super great on the supplement side. Plan N looks very different because many times to get on it, you're underwriting. Many of the other times, like UHC has your plan toggle that you can go towards. There's a lot of opportunities to make more money on the clients that you already have. And that's a really easy way to help fund some of the other extra fun stuff. And the last one I wanted to just outline was just AEP prep. If you guys are going through and mining your data, make sure you have all the things you are going to need to run a quote for them this AEP. We just came out of, arguably, the spookiest, craziest, change-heavy AEP since the introduction of Part D in, 2006. Buckle up, because it's not stopping.
Yeah.
We are going to see carriers reevaluating how this past year went. They didn't have any data to go off of. Now they do have a little bit of data.
Yeah.
So we're going to see a restructuring of plans. We're going to see carriers that won in certain areas that didn't want to win in those areas, and they're going to have to make a change in order to stay in the market. So I'm saying now, take the time, whether it's a client appreciation event where you have them drop off their updated information in order to be entered into win a bicycle for a grandkid. There's so many ways that you can do this. You have to be loud this year. You have to be working very closely with your current clients so you don't lose them. and you've got to be looking at different things.
Yeah.
It's got to be different this year.
Next week, Olivia will be joined by Chalon Jackson on the cafe. He is our compliance officer here. He also is, there's not really an official title for it, but he
Big wig.
is, we have other
Genius.
people in the industry flying him out. Literally all across the country to be an expert in compliance and a lot of the legislation and stuff like that that's happening. So yeah, he's kind of a big deal.
And he's ours.
And we're going to have him on the cafe next week, and they're going to talk. Anytime you have Chalon, it's a get your notebook out sort of like situation, because they'll be talking about in practical things to take away from like the legislation that's going on, what this AEP is expected to look like, and all that sorts of stuff. So definitely tune in next week for sure. And if you can't make it, make sure to watch that live recording. But a lot of that stuff that we were talking about today, about these changes that are coming up and whatnot, they'll be talking about that a bit next week. So
maybe what we can do too, and kind of to help us end up and wrap up, because we've gone over most of our time. I may not have the end slide. Oh, this one. Is if you have questions or whatnot that you guys want to go ahead and maybe have preemptively held, or we can try to maybe see if there's things that we can kind of get started for you guys for Chalon and Olivia next week. Put that in the Facebook group. This is a great time for the conversation about the things that we talk about that may have triggered an idea or a thing that you want to try and implement into your business. Does not have to stop here whenever the live ends. Join the Facebook group. Gauge what other agents are been doing over the years, are starting to do. If you have ideas, that is exactly what that type of group is for. Plus, you have access to some of us here at Senior Marketing Specialists and part of the Medicare Cafe crew who can help kind of feed the flame on some of that as well. That way you guys, have the resources and all that type of stuff to help you kind of explore those ideas and options.
Yeah, absolutely.
Cool.
Cool.
That was all. I know that was a lot, but
It was a lot, but that's good.
I think it's good stuff. Each one of those has been 80% of the conversations that I'm having with agents and agencies in all throughout the nation. So,
and if you want more resources, we have tons of resources on all the things that we just talked about. Give us a call, talk in, utilize the Facebook group. That's the way to say that. We love to connect with you guys, answer whatever questions you have. But that's what we have for this week. Definitely join us next week. You have anything else?
I don't think so.
Cool.